Hi, and welcome back to the CyberKnife CK Cam. I'm Sasha, and I've been joined once again by Dr. Omar Dawood, Vice President of Clinical Development here at Accuray. Omar's going to help us break down some of the differences between the CyberKnife robotic radiosurgery system and the GammaKnife system. Omar, we hear from a lot of patients that there's a lot of confusion around the differences between the two systems because they do sound so similar. They're not the same system. There's a lot of differences, right?
Correct. They actually are quite different. Now, historically, they're both based on the same principles of radiosurgery, delivering hundreds of uniquely angled beams from many, many different angles, having all of those beams intersect at the tumor or target. That allows clinicians to deliver very, very high doses of radiation and to do that safely while sparing normal tissue.
And that's the definition, in essence, of radiosurgery, correct?
Correct. So they're both radiosurgical systems. Where they differ, the GammaKnife was developed about 30 or 40 years ago. And the CyberKnife actually was developed based on the similar principles. In essence, one could say that the GammaKnife paved the way for the CyberKnife. With the GammaKnife, to achieve accuracy and precision, the two key ingredients that are needed for effective and safe radiosurgery, clinicians had to put on a frame. And that is exactly as it sounds, is actually bolting a frame onto the patient head, and then achieving accuracy and precision, identifying where the tumor is located, and allowing the system to actually target that tumor.
Oh, that sounds scary.
It can be for patients, but at the time, if that's the way that you can achieve an effective treatment, then it's really worth the risks.
Does the CyberKnife need that type of?
So no, it doesn't actually. The CyberKnife is a completely frameless system, and actually, it's even unique when you look at it because the CyberKnife is a robot, versus the GammaKnife that actually looks more like a shell that contains the radiation sources. So what's unique about the CyberKnife is that it's actually able to target and identify where the tumor is without using a frame, completely non-invasively.
Interesting.
It is quite interesting. And because the radiation source is mounted on the end of a robot and it's a frameless system, it's allowed clinicians to take those basic principles of radiosurgery that were so successful in the brain, within the head, and actually use those principles throughout the body for tumors like lung cancer, prostate cancer, liver, pancreas, kidney, really many, many different target sites, the spine, all around the body.
So the GammaKnife was created to only treat tumors in the head.
Correct.
But the CyberKnife treats tumors anywhere in the body. Why can't the GammaKnife treat tumors anywhere in the body today?
Well, again, we go back to how do you achieve safe and effective radiosurgery, and to deliver these doses by sparing normal tissue, you have to have accuracy and precision, identify where the target is, where the tumor is. The GammaKnife relies typically on a frame or some type of frame-based system to achieve that. You can imagine it's really difficult to bolt a frame, for example, on a person's pelvis and treat the prostate, or to do that in the lung. It gets more complicated when you're outside of the brain as well, because the targets are moving.
Right.
And so when you think about it, for the brain, with the GammaKnife, you would mount a frame on, and you really don't have a lot of movement. You can therefore pinpoint where the tumor is. You can't do that same thing, for example, in the chest or the spine or the pelvis, even if you wanted to, because the tumor and the organs are actually moving inside. That's the beauty of the CyberKnife. As these organs and tumors are moving, for example, in lung or in prostate, sometimes they're moving predictably, sometimes they're not moving predictably. Having a system that can continually, throughout treatment, assess where the tumor is, and then having a robot in the room that can actively correct for that movement, follow the tumor and essentially chase it, ensuring the radiation beam is always focused on that tumor, allows you to achieve those two key ingredients of accuracy and precision, and therefore enables radiosurgical treatments throughout the body. When we think about it, there are many instances in which delivering dose in one treatment with radiosurgery, for example, for a brain tumor that's very focal, may make a lot of sense. But there are certain tumors that are near critical structures, for example, a central lung tumor, in which you may need to deliver doses in 2, 3, 4, 5 fractions. Well, when you have a frame-based system like the GammaKnife, regardless of where you are, in the brain or other areas, it's very difficult to actually deliver more than just one fraction. Because otherwise the patient has to either stay in the hospital with that frame, with some type of
to the head.
exactly with some type of anesthetic, or the patient needs to come back for several days, and each day they come back, you need to put that frame back on. You can imagine that's really challenging for clinicians and patients. It is so enabling having a frameless system like the CyberKnife, in which you can have the patient come back for multiple sessions. Let's say they need to come back for 3 days, or 4 days, or 5 days, because you want to fractionate, as we say, spread that dose out over a number of days. You can easily do that with a frameless system and still ensure that you're going to have a very accurate and precise treatment.
And it seems to really define the CyberKnife as being truly non-invasive.
Correct. Correct.
Interesting. So it seems like the GammaKnife is, in essence, as you mentioned, paved the way for CyberKnife radiosurgery. And while they both deliver the same sort of radiation, precision, fewer fractions, high doses of radiation, that the way in which the patient needs to be set up in order to deliver GammaKnife radiosurgery versus CyberKnife radiosurgery seems to be the primary differentiator between the two.
That is the basic differentiator, and then therefore that then creates massive differences in the applications that can be treated.
All over the body versus just in the head.
Exactly.
Fabulous. Thank you so much for taking the time to join us
Of
today.
course. Thank you for the invitation.
And thank you for watching. We'll see you next time. Sasha with the CK Cam.